Welcome back to the Change Physician Podcast. I'm your co-host, Dr. Melissa Cady, joined by my co-host, Dr. Kevin Cuccaro, and we are here with our guest, Dr. Eiman Jahangir, who is a clinician, educator. He has a background in internal medicine, cardiology. He's a researcher and a blogger and all kinds of things, and we're looking to explore his story a little bit. Thank you for joining us.
Thank you for having me.
Absolutely. Well, we always start from the top. So when it comes to pre-medicine or pre-medical to the medical field, what was it that really got you to want to go into medicine in the first place?
I think I sadly have to say, I think it was the familial upbringing. So my father's a physician. We have pharmacists, dentists in the family. And so from a young age, it was, you could be a doctor, you could be a lawyer.
Wow.
I think it's akin to people who become firefighters if their dads were firefighters, right? Or their moms were a cop and they become a cop. And so because of that, I always knew that was the road I was going to go, but by no means did I do it without resistance. So in college, I decided to be a religion major instead of a biology major. I toyed with being an anthropologist, but it always came back to years of teaching me that I should be a doctor.
Lots of self-sacrifice. You are not the only guest that said this.
Yeah. It's a common story.
Yes, it's a very, very common. Well, back then in your mindset, when you decided you're going to medical school, what was your vision of what you'd accomplish or what it would be like? What was that, naive, I should say, or early vision of it?
That's a great question because I don't think anyone's asked that. I suspect that I assumed I would be taking care of people. I would be making a lot of money and I would be maybe teaching. I did not suspect I would be spending hours on healthcare, because when I started this, there was no EMR. It was maybe for labs. So unlike students coming in today, I did not appreciate that this would be such a large part of my life, that you would be dealing with electronic medical records and billing and insurance. But I did think the patient-patient, physician interaction and the student interactions would be part of it. I assumed I would be in academia and not in private practice. So that has somewhat held true.
Yeah. And I assume your parents were proud of you?
They are. They are so proud. Even more proud because I moved back to Nashville, which is where I grew up, and I don't think any of them expected me to come back. So,
oh, well, there you go, close to home.
If we have time at the end of this, I want to ask you about Nashville because I have this weird fascination with Nashville, and I want to go there someday. But so I don't know if this is the advantage or not, but you said your physician's a father?
Yes.
Your father's a physician.
My physician is also a father. That I do know. Yeah.
So you had a little bit of well, as much as anybody has, you have that kind of a familial experience with it. But when you were in medical school, so you're now into this career path, you chose out of your wealth of options between law and medicine, and you chose medicine. And so now you're in medical school. When or was there a time during medical school where you're like, wait a second, this isn't exactly what I signed up for? Or did you kind of know what you were getting into?
So for me, medical school was fun. It was a rude awakening because I think in college I skirted by, especially being a non-science major. So as soon as I realized I had to study harder, that rude awakening kind of changed. I think for me, there were obvious points in medical school. My brother was an intern in surgery. He's an orthopedic surgeon. We lived together. I was a third year and he was in his intern year. And I was like, nope, not going to do surgery. Like very hard set decisions, seeing what his life was like and it kind of changing what I was going to do. I think that it really set in residency. So med school was fine. You work hard, but I was younger. Not that everyone in medical school is young, but I think that was exciting. And then I think when I got into residency and I saw, okay, this is the day-to-day, this is what I'm going to have to do. This is not some sort of get rich overnight scheme where there is no, there's guarantee, but there's no kind of big blowout payoff at the end if you just keep doing this. So in residency was when I really realized that maybe this wasn't what I signed up for.
Yeah.
And then with that, because residency is tough, period, right? And I think everybody going through residency at some point is like, oh, I don't know if this is what I need to do. We had another guest to talk about, at some point you get in where the debt is like, well, there's nothing else I can do because I got all this debt. But once you finish residency and you start going into, say, practice, or actually after you finish your fellowship, because you did a cardiology fellowship, when did you start looking to do things either in medicine or outside of medicine to kind of take control of your life again?
I mean, in residency, I applied to be an astronaut, so I guess I was looking for a job, but one that was respectable, maybe not as financially secure.
I love your background for it.
So I did that, and then in fellowship, which arguably to me was harder than residency, first year fellowship was a rude awakening. I also started thinking about things I could do differently. And so I was always thinking about ways to make money that was outside of medicine, so there's no conflict of interest, but while still practicing. Because as you said, I think until you're at least at some financial stability standpoint, it's really hard to take that jump fully out of medicine. The guaranteed income is pretty good for, the work. So, I mean, starting in fellowship, I was thinking about it. I didn't actually take much action because I think I was always with the mindset, well, I should go practice for a couple of years, see what that's like, and go from there.
Mm-hmm. So what was the shift in when you did some non-medical things? What was the shift, and where did it go initially?
So, I mean, I tried a lot of different things. I tried some of these online things where you could go and take a bunch of surveys. I think every medical student probably does that, or resident. Hey, maybe I can make a lot of money like this. I looked into starting a blog, but when I first came out, it seemed overwhelming, to kind of try to learn something completely new. So I hadn't done that quite yet. And I was always talking to family and friends to see, okay, someone's starting a business. Can I get involved? What can we do? But then the issue was I didn't have any capital, right? So I was 31 when I finished training. I had over, $200,000 in debt, and you haven't made that. You've made a decent paycheck because residents get paid what most Americans get paid, but you haven't made that doctor, quote unquote, doctor salary yet. Mm-hmm. So it was all just kind of small scale things, trying to figure it out while becoming a doctor.
Right. What are some of the frustrations or conflicts that you had maybe when you got into private practice that really steered you into that, looking at some other things, even with more, conviction?
So for me, I mean, I guess you could separate it into two parts. One is, why was I looking? And one was, why did I not want to use my medical license? And part of it was just restrictions in the ability to use your medical license with the contracts I'd signed. Because it's not like I own my own practice. So I always worked for a big company, either a big hospital chain or a big private physician group. So it was more that I couldn't use my medical degree, quote unquote. Personally, for me, it was that like most physicians, I think I was getting burnt out. I was just doing it day in and day out with no end in sight and not taking control of my own kind of life to make it the way I wanted it, right? I don't think any of us inherently dislike practicing medicine. I think practicing medicine is a beautiful thing. And every day I connect with someone, whether it's just to alleviate their anxiety or if it's actually to make a medical change. I think I told a patient yesterday that 85% of what I do is just alleviate people's anxiety. It's not even doing anything, medical. But it's that the way the system is set up and the way the rewards and the, not punishments, but the carrot and the stick are used, I think made me very apprehensive, at least that this should be a long-term plan without thinking of other ways we could also change or find a practice that actually worked best for me, which is kind of where I am now.
Right. And so how would you describe now? What does now consist of?
So I'm in academic medicine. I'm at Vanderbilt, which is great. It's a great place to work. And I trained here. So I came back, after being out for 7 years, back to where I was a fellow. And it was nice because I'm at the VA part-time, I'm at Vanderbilt part-time, And then I'm also work at the medical school. So I teach. And so between those three things, I have a very diverse day. My week is very diverse. It's not like I'm stuck doing the same thing at the same place every single day. And it's nice because I can teach. I have fellows, I have house staff, I have medical students who are very eager. And you talk about trying to think back to medical school. I mean, you see these guys and they're, 21, 22, 23, 24, and they're green. Like, they haven't seen any of this, and you forget how green you were. But it just is nice because they also bring in some positivity and enthusiasm and remind you as to why medicine could be enjoyable and is enjoyable.
What are the topics you usually teach them about?
So I do a few things, but right now they have these small groups that we facilitate. And so there was a homeostasis block, and now there's like a brain movement neuro disorder block. So you work with them basically 6 hours a week and going over cases, discussing cases. But I have other roles, but that's kind of the one I'm doing currently actively.
Nice.
Was that one of the reasons that you went back to Nashville, was for that specific position then? Because it's having that diversity of experiences and choosing a geographic location and a system that facilitates that. Not everywhere has that, right?
No,
so
yeah. No, yeah, I mean, completely, yeah. This was, I'd worked in New Orleans at a big hospital-based group that had fellows and some medical students, but wasn't as big of an academic institution. And then I went to Kaiser Permanente, which is, a private physician group on a very large scale. And I missed it. Like, I absolutely missed working with students, and I did not like the idea of having to do the same thing every day for 30 more years. Mm-hmm. So the beauty of going to an academic center, and this is what I tell the house staff and fellows who are looking for jobs, I'm like, my ability to do things that are not just clinical is much wider. If you go into private practice, you can do clinical work, and maybe you can do administrative work. You could become the guy who runs the office. If you go into academic medicine, you could do research. If you want to apply for grants, you can teach, you can do your clinical work. And typically most of these institutions are large enough to where you can fluctuate. So it's not that they need every single body at full capacity.
And I think that's important to, because there's a theme that keeps coming up with a lot of this stuff, is that there's a conscious choice involved, because you have to recognize that it is not necessarily all about the money, because there's a private practice group that's going to probably pay a lot more than what this is paying. But the choice of, hey, I'm going to go to practice that's going to kill my soul to make a little bit more money so that I can, retire in 20 years or 10 years or whatever. What's the price of your soul for that? Yeah. And so it's just interesting. So, you've looked at all these facets, and then you've now taken control of your practice by choosing the environment that allows you to have diversity and find enjoyment in medicine again. So I applaud you for that.
Thank you. It was not a short or easy route.
Never is.
And some of it is just being, realizing what's enough, right? When I could work harder and make more money, but I realized, well, honestly, I'll only get 50% of that because it goes to taxes. And then to what value? You have to decide what's important. How big of a house do you need? How expensive of a car do you want?
Yeah, definitely choices. So being that you're working with medical students and this curvy long road that you've taken, what would you tell yourself or the students that are before you, what they should know, or what would you tell yourself about, when you enter medical school and your expectations?
The one piece of advice I think I wish I had learned younger, but I will hold through the rest of my life, is it's never too late to make a choice. Like, you can always choose to do something different. If you take a job and you show up and it's terrible, you can always move. So don't feel afraid to do that. I was supposed to do interventional cardiology. I had a fellowship lined up. Then I realized that the reason I wanted to do it was it's exciting, but that the downside would have been I'd be on call, much more frequently. I'd be having to come in much more frequently. And as my wife tells me, like, call kills me. Like, I hate going into the hospital in the middle of the night. I'll do it, but it's the one thing that I know I don't enjoy. So why would I choose to do another year of training so I could do more of that? And I pulled out like 2 months before I was supposed to start the fellowship, which was not easy for the program, but better to have a happy general cardiologist than a miserable interventional cardiologist.
Absolutely. No, and you're trying to be true to yourself and aligned with your values, and and not letting the guilt, misguide you. So that's great. Do you want to go with the Dr. Cuccaro? Do you want to ask him the last question, or do you want me to go for it?
Well, I was going to just ask another question.
Go ahead.
And that is that we're kind of flipping this a little bit. So doing this whole journey that you did, at some point you did start a blog.
Yeah.
So when did you start that? Why did you start that? And ultimately, how did that sort of develop, and what were your experiences with it?
So it was initially Dad's Dollars and Debts in 2016. And I had just left my first job for my second job. And the second job was at Kaiser. And one, I had more time because now I wasn't doing research. I wasn't writing papers. So I found myself with more idle hands, I guess, which was new and which was nice. But the other side of it was, at that point, I had been reading heavily in personal finance, the sites that most people are familiar with. At that point, it was White Coat Investor was really the only one. And then Mr. Money Mustache was another one that was popular at that time. And there were none of these other sites were available. They hadn't even started. So I just started writing down my ideas about things that I thought were important, things about living in moderation, figuring out what your balance was so that you don't have to kill yourself to drive a Porsche if that's not what you want. Like, it's okay to drive something else. And also writing about personal finance, because I do think it's something that we don't learn in medical school, and we're getting better about that. So, currently I gave a lecture to the House staff about personal finance, and it was just kind of like an overview. But these are things that I think the younger generation are thinking more and more about. But at that point, we hadn't done that. So my blog was initially anonymous, and so I just kind of put out a lot of ideas. And I think anyone who's thinking about starting a website but is afraid to put themselves out there, doing it anonymously is actually a really nice way to do it, because then you can get your thoughts out there, you can see people's reactions, and then if later you want to, actually out yourself, you're
But that's a great point, because there's a lot of people I think that are like, they're scared because you mentioned this earlier on, that a lot of your interests when it came to business, you were restricted because of the contracts that you had signed.
Yeah.
And so I just like that idea of just starting something that you are interested in and doing it. You can publish whatever. I mean, that's one of the things about the internet. You can publish whatever you want on there. You don't have to reveal yourself. So take the opportunity. And as you were writing, did you find that you were enjoying the writing at that time? Or,
yeah, very much.
Okay.
Yeah, no, it was great. I mean, every night I'd spend 7 days a week on that site for about 2 years. Wow. We had, I don't know how much of my site you looked into, but our house burned down in the wildfires in 2018 in Northern California. Whoa, and I think after that, I wrote for a while, but then things changed, right? It was like just trying to get my life back together with my wife and my son, and living, and were we going to move or not? And I think that was where some of the energy, because once again, you have to choose where you put your energy too, right? Diminished. And then when I came here at my current institution, I'm just doing more things, with education, with writing research papers. So, which I'm enjoying, right? And this goes back to your idea of you should do the things you enjoy. And that's why I think the website kind of less posts, was less active.
Right.
And then you exited it.
And I exited. Yeah. It sat there for about 1.5 years without, I think I posted something like 170 posts in 2017. And then over the course of 1.5 years, maybe I did 5. And I said, okay, well, I have to decide if I'm going to keep paying for the website and the hosting, or am I going to reinvigorate this, which I didn't really have an interest in doing, or should I see if someone wants to buy it? And there was surprisingly decent interest. I mean, you have to go through the right people to get to those individuals, but it was nice to at least know that I could make a product and then sell it. And it's on the internet in some form now, so you can still find my articles out there. You have to look a little harder, I guess.
Yeah. Well, I'm, it was really nice to hear how you mentioned how you have to put your energy in certain areas. You can't be everywhere, but I love how you found ways to reinvigorate your enjoyment in life by, you know, when you had the blog and you, even though you were doing your practice still, I would assume that there's probably some level of kind of an energy renewal when you do that, when you're going to see patients too. It just had a different feel. Is that
No,
kind of how?
Catharsis, I think, to write. I think anybody who's a writer knows, or any sort of performer, I think, right? And it's nice for anyone out there, I'd say it's nice to have things outside of medicine to do, right? You have to have something to focus your energy on that's beyond your family and beyond medicine, and is something for you, whatever that may be, and however much or little time as you spend on it.
Yeah, and go ahead.
I was just going to say that, and that's another thing where in this day and age where we are now, it is so much easier to actually either find like-minded individuals, so there's tons of groups, or to publish, which I would encourage people to do, is actually publish on your own. So if you're a physician, we need physicians that are publishing content. You know, there need to have physicians that are talking about financial matters. We need physicians that are publishing about health-related concerns or diet concerns or anything. So it's just neat to hear that you did it. And then not only that, you did it, and then at some point when it became, you know, you couldn't devote the energy, you were okay with exiting it in this situation. You could sell it, so that was great. But you know, it's just a perfect chance to experiment and emphasize and optimize your career path rather than, you know, feel we're all stuck in this real narrow lane.
Yeah. Remember, you're not stuck, and the sooner you make good financial decisions, right? Like if you get rid of your debt, I think the debt is what, just don't take on a lot of debt when you come out, because then you really can make decisions, right? I mean, it's not this idea of selling your soul for 20 years to then retire. It's more, how do I make smart decisions early so that in 5 years when I am burnt out, I can choose to go into academia, or I can choose to be a flutist. I don't know, whatever you might be.
Yeah, you know, so it was interesting how you said you had this like cathartic feeling of doing the blog, and you're really teaching in effect. And then it's interesting how you have this passion for teaching in different forms, and you're now helping teach medical students. So speaking of teaching, you know, books obviously are a source for learning. If there is one book, is there a particular book or other resource that you'd say had like the most impact on your life or your path as a physician, or doing something other than medicine?
I mean, my favorite book is The Alchemist by Paulo Coelho. And I mean, it's not about medicine, it's not about personal finance, but it is about someone finding their path. So I don't know if you know the premise, but it's a shepherd who then basically goes through a journey and discovers kind of his role in life. And I think that, I mean, this talks to what you guys do, which is you're not necessarily, whoever you are today is not who you have to be even a year from now. And so you have to be willing to take risk, and you have to be willing to kind of look inward so that you can make the best outward life that you want.
Perfectly stated. Yeah.
Absolutely. Great. Great final statement. I don't know if I can say anything else.
We can't top that.
No.
Are you gonna? Am I the outro person today? Or are you the outro person?
The outro is.
Your outro.
I'm the outro. All right, so I will do the outro and thank our guest, Dr. Eiman Jahangir. Jahangir. Did I get that? All right. Sorry about that.
You got it.
But thank you so much for coming on the podcast today. It's really great to hear your changed physician journey, and to really emphasize again, like you just said, that who you are today isn't who you are going to be tomorrow, and that we all have an active choice in this. And so everybody out there, actually, I forgot about that. Do you have a place that people can contact you?
I guess my Twitter handle is probably, at Eiman Jahangir. So first name, last name. You know. Okay,
and we will put that in the show notes as well. Because we were talking to somebody else. It's just nice to know that if someone resonates with you, if they could just lightly contact you and say, "Hey, I'm struggling with this," because we physicians all think our story is unique. And they are all unique, but there's some commonalities that we all experience here.
Yeah.
Well, thank you again for coming on the podcast today. And until next time, everybody, stay well.
Take care.
Thank you.